Coming up on the Rundown.
Medicaid expansion is now reauthorized.
With a final signature from the governor, the future of Medicaid expansion, which provides health insurance to 1 in 10 Montanans, is set for now.
It's starting to pay off in terms of more Montanans being healthy.
But could 2020 bring a massive shakeup in healthcare coverage for Americans?
There's tons of problems in healthcare. This isn't the answer.
We look at the mark Medicaid expansion has left on Montana communities.
We know for our communities, big and small, that we had to get it done.
And what's ahead.
Let us have the same Montana dream.
The Rundown starts now. The Rundown is made possible by the Greater Montana Foundation, encouraging communication on issues, trends, and values of importance to Montanans. Welcome to The Rundown. I'm Jackie Coffin. A months-long debate on Medicaid expansion is settled. With bipartisan support, the largest issue of this legislative session passed and was signed into law by Governor Steve Bullock here in Helena on May 9th. Out to celebrate the bill signing were healthcare providers and patients, CEOs, advocates, and tribal leaders, Democrats and Republicans. Medicaid expansion was back on the table for Montana lawmakers this spring due to a sunset built into the 2015 bill that would cause the whole program to expire in June of this year unless a new law was passed.
When I stood before the legislative body in January for my fourth and final State of the State, I asked that we continue what has been really the greatest jobs bill that we've had in our state, what significantly dropped our uninsured rate in our state and also lowered and reduced uncompensated care costs. I ask that we continue what has given Montanans health care, both physical and mental, that allows them to work and not be one medical bill away from bankruptcy. What's provided the security and the access that every Montanan deserves to have. I'm so pleased to be here before you today, knowing that we're preserving all of this and indeed more for Montanans.
Sitting next to the governor were Representative Mary Cafaro, a Democrat from Helena, and Representative Ed Buttrey, a Republican from Great Falls. They led their parties' respective efforts to expand Medicaid and worked together to push through one final bill.
One of the most important thank yous for me is to my colleague, Representative Buttrey, for bringing the solution forward and putting the health and well-being of all Montanans first. Thank you.
The new law, penned by Buttrey, is 47 pages long, but let's pull out some fast facts. The new Medicaid expansion law will continue health insurance coverage for 97,000 Montanans at or below 138% of the federal poverty line. For a family of 4, that's a max household income of $35,000 a year. For an individual, it's $17,000 a year.
We have greatly shrunk the pool of uninsured in Montana. We've taken that population from 20%, depending on which year you choose, down into single digits.
The new bill once again carries a sunset, setting it to expire in 2025. It will be paid for almost entirely by the federal government through the Affordable Care Act, but to cover the state share, an additional tax will be put on some hospital services. The way Medicaid expansion is paid for in Montana was detailed in a report by the Bureau of Business and Economic Research at the University of Montana.
Our liabilities in terms of paying for that money is very, very tiny, but the money coming in is very significant. And so that has helped support a whole range of things.
A final fast fact, and one of the biggest points of contention in negotiations, is the addition of community engagement requirements.
A major change as seen in the bill is the inclusion of 80 hours of community benefit requirements for those individuals that can work and are between the age of 19 and 55.
Democrats largely support Medicaid expansion, but work requirements are unpopular with the party and other Medicaid proponents.
First of all, we think that they're contrary to the intent of Medicaid. The data that's available here in Montana that has been shared with me indicates that the majority of Montana Medicaid enrollees are working. I think it's 7 out of 10. The remainder are either in school, caregivers, or have some other unique situation where they're unable to.
It is so administratively complex to get through there. Some people will throw up their hands and give up.
I do understand the struggle with work requirements that many folks in this body and in my body have, but I believe the people of Montana, both through the results of the voter initiative and also as seen in a statewide poll, clearly believe that those that can work should have to meet some community engagement requirements and able to receive taxpayer-funded health care.
But even those were ironed out between both parties.
I do want to thank the governor and his staff for all the hard work and the many solution-minded legislators that are here that put extreme ideology aside and helped to craft and ultimately pass this law for the good of all Montanans. We truly put Montana first.
For a lot of people in the room on Signature Day, the event was a breath of relief, held for 6 months by some of the people who had the most to lose if the program wasn't renewed. 200 miles to the north of Helena sits Montana's High Line, a chain of towns small in population but huge in Montana's #1 industry, agriculture.
You know, we've got predominantly a farming community, some ranching. It's an agricultural-based economy, and the fact that a place like Chester exists. I mean, we're 60 miles from Havre, 45 miles from Shelby, and 90 miles from Great Falls. So long distance to travel for healthcare services. And what we found is, we have a 24/7 ER, and it matters because people get hurt, people get sick. Like at the end of the day, they need healthcare coverage and services.
Matt Waller is CEO of Liberty Medical Center in Chester, one of Montana's 48 small-town critical access hospitals. Altogether, these critical access hospitals serve about half of Montana's population.
So we're a 25-bed critical access hospital. We have an attached rural health clinic as well as an assisted living facility. This is a kind of a pillar of the community. There's been a lot of time, energy invested in this place to ensure that a place like Chester, who's got a population of under 1,000 in the kind of community, the service area is about 3,000, that this place has a medical facility.
Across America, rural hospitals are closing. A report from the U.S. Government Accountability Office shows about 100 rural healthcare facilities have closed since 2010 at a rate of 12 a year. Not one of them has closed in Montana.
As Montana as a whole, we're an independent group. I'm born and raised in Montana, and there's a level of rugged independence, and I think maintaining strong rural communities. I mean, we're the biggest employer in Liberty County, and that comes with a weight, but we want to be that contribution to our community, and I think we have significant economic impact to our state as a whole. So if you look at Little Chester, Montana, but then you aggregate that across all of these other, quote unquote small towns, we add up and I think really make a difference.
So what's kept Montana's rural hospitals alive? I visited 3 hospitals along the High Line in Cut Bank, Chester, and on the Rocky Boy Reservation to find out.
My name is Sherry Taylor. I am the Chief Executive Officer here at Northern Rockies Medical Center. I think a lot of times what we see in rural places is what it actually just keeps our services open. Look at other states, and I'd be surprised at how many states that expanded Medicaid, how many of them had closures of hospitals. But how many had closures of hospitals who didn't expand Medicaid? I think in Montana, we've had no closures of any hospitals. And I think that's phenomenal because it's happening all over the states every day, all the time. And in Montana, we have had none. And I think a big key component was Medicaid expansion came in, and the ones who were struggling and were very close to that were able to stay.
What it's done is it's stabilized. It's stabilized us because when people, who are unable to pay, they'll still receive healthcare services. At the end of the day, if you're sick, you'll receive healthcare services. It's just really a matter of when and where. Our providers would much rather see somebody in our clinic 2 weeks before they, really get sick, versus having to have someone have an acute episode that requires a transfer by ambulance by a volunteer staff. I think that's kind of what Medicaid expansion has done for us, is going, how do we deliver the right care and provide access for people to manage those things that don't always have to be a crisis.
We in Coffin probably had more of a dramatic increase because we had a higher population that became part of the Medicaid expansion and the HELP Act. But to give you a comparison, you'll see that, especially on uncompensated care, there was statewide for rural hospitals, there was a decrease of like 38%. And for the larger hospitals, 28%. But we were closer to 60% decrease.
I am Jessica Windy Boyd, and I am the CEO for the Rocky Boy Health Center. Our facility is a 90,000 square foot facility, so it's just under 2 acres. If you were to walk the entire facility, you put on about 3,000 steps. We are an all-inclusive healthcare center, so we do everything from ambulatory healthcare. We do urgent care from 8 to 4:30. So we do have a helipad. We do send out patients to Great Falls if needed. We're kind of the first response during that time. We have a very active EMS program, so we have full-time EMS, 24-hour EMS services. I see that. Oh, excellent. I see that. Medicaid expansion has been very key with addressing the services for our most vulnerable population. We're probably the only population that had to have a committee that would come together and decide if you needed a service that was not provided in our healthcare system. And in most Indian healthcare clinics are ambulatory care. There's very few hospitals. Even the hospitals that are in the system don't do a whole lot of services because it's become so specialized. Hospital care is very specialized now, very expensive, and the risks are very high. So a lot of Indian health services, there's very few actual hospitals that provide a full level of care. And here in Montana, you have two. You have Fort Belknap, or three: Fort Belknap, Crow, and Blackfeet. And Fort Belknap really just does, it's like a critical care hospital. They don't do a whole lot. So you'd have to be referred out, and in order to get that referral, you had a committee that would come in and they would rank how sick you were. So if it was life or limb, okay. Regardless of what the budget is, you usually went for life or limb. If it was something that made your life miserable, but it wasn't deadly, like having a tore up knee or having your arm, your rotator cuff tore, you were always a 2 or a 3. And I can't imagine any other segment of society that was told, yeah, we know you're in pain, we know that you need a new knee because there's nothing left, but we're going to put you on the waiting list and we'll see if we'll have funding next year. And in the meantime, we'll give you physical therapy, we'll give you a cane and a crutch, we'll give you some pain pills to handle it. And that's the type of health care that our individuals have. Now that you have Medicaid and you have other options for insurances, we can handle that. People are getting their knees replaced, and they're getting them replaced while they still have quality of life, while they're still young. We're not waiting till it's so critical that they can hardly function. There still is that perception that, reservations are just enabling natives to not be able to help themselves. There's no need for a reservation. They just follow the reservation and all the economic issues for tribes are solved. Not true. People choose to live on the reservation. And the fact is that natives will always live together.